Today, I'm going to highlight 3 recent healthcare industry trends that you should know about in 2026. We'll discuss new trends in telemedicine, wound care, and projected growth in the uninsured payer mix. First, some major telemedicine payment changes snuck up on providers during 2025, and most haven't even realized they happened yet. If we have another pandemic today, telemedicine reimbursement is now between 20% lower and 35% lower under most commercial health plans. The American Medical Association created 17 new telemedicine billing service codes that went into effect during 2025. Medicare was prohibited from adopting these new telemedicine billing codes because Medicare has a statutory requirement to pay eligible telemedicine services at the same rate as in-office services. However, at this point at the end of 2025, I can confirm that most commercial payers have adopted the new telemedicine billing codes at 20% lower to 35% lower reimbursement rates than in-office equivalent services. All provider organizations should check their contracts to see how commercial reimbursement for the new 17 telemedicine service codes compares to your in-office rates for the same services. Another big change will affect wound care in 2026. Medicare spending on skin substitutes used in wound care treatment grew about 4,000% or 40 times between 2019 and 2024. To curb this exponential growth, Medicare has enacted a new payment policy that takes effect January 1st, 2026. Up until now, skin substitutes were considered biologics, payable under Medicare's average sales price, or ASP methodology. But beginning on January 1st, 2026, Medicare will start bundling skin substitute reimbursement in physician service fees using a single flat payment rate of $127 per square centimeter across all procedures. That is much less than the $1,000 to $2,000 per square centimeter sales prices that some manufacturers have allegedly been reporting. Medicare estimates this will reduce program spending on skin substitutes nearly 90% and save Medicare billions of dollars. Finally, we need to talk about projected increases in uninsured payer mix. At this point, we are projecting a large increase in uninsured patient populations during 2026. This is driven by 3 changes. First, certain enhancements to the advanced premium tax credit are set to expire at the end of 2025. The advanced premium tax credit is not going away altogether, but it will revert back to its original lower income thresholds and out-of-pocket premium percentage limits prior to 2021. Marketplace health plans will be more expensive as a result. Over 19 million Americans use the advanced premium credit. This subsidizes their health insurance costs during the 2024 plan period. This represents over 90% of Americans who bought plans on these state health insurance marketplaces. Second, the underlying health plan premiums on these state health insurance marketplaces are projected to increase anywhere between 17% and 30% across states, with an estimated average increase about 26% nationwide. So we'll have both smaller subsidies and higher premiums on those marketplace health plans. Lastly, under H.R. 1, or the One Big Beautiful Bill Act, the Congressional Budget Office projects Medicaid enrollment to initially decrease by 4 to 5 million enrollees. Several other new eligibility requirements will take effect throughout 2026 that are also expected to reduce Medicaid enrollment. No one knows for sure how much the uninsured payer mix is going to increase in each state. Each state has decisions to make about how to deal with the loss of federal Medicaid funding. States may reduce Medicaid eligibility, increase state spending, reduce benefits, or a combination of the 3. The largest states are projected to be impacted the most, including California, New York, Texas, Florida, Illinois, and much of the Midwest. Safety net healthcare organizations, federally qualified health centers, and providers in states with expanded Medicaid programs should prepare for these changes. If you have questions or concerns about any of these trends, please contact Coker today.